How do you analyze production when you're looking at a dental practice you might want to buy? You're going to want to look at three categories when analyzing the production of a dental practice: the ratio of production to collections, how much hygiene is being done, and the actual procedures, production by procedure code. I'll talk about all three. Before I do that, let me caution you a little bit. A lot of dentists, when they start getting information on a dental practice, they start seeing a lot of numbers. Tax returns, profit and loss statements start coming in, and then someone hands them a production report. And dentists get excited because they understand the numbers on a dental production report. That makes sense. Production is super important. However, production always takes a back seat to the actual finances of a dental practice. What happens in a patient operatory eventually translates into hard dollars and cents, and you're going to see that in the financial information that we talk about in a lot of other videos. When you are looking at the production, the first thing that I look at is the ratio of production to collections. The magic number is 95%. You want to see a ratio of production to collections of at least 95%. In plain English, if a practice produces $1 million of dentistry, you want actual collected revenue, actual dollars coming into the business checking account of that office to be $950,000 or preferably more. If it's $930,000, $920,000, okay, you can ask some questions. But every once in a while, we'll see a practice where the production to collections ratio is 82%, 76%, where there is a massive discount between the work being done and the patient's, or usually more accurately, the insurance company's propensity to pay for that work that's being done. You want to make sure that you're buying a practice where you're going to see the fruits of the labor you're doing. 95% is a great benchmark for a decent practice with good collections and good reimbursement rates from insurance companies if that office isn't fee-for-service. Obviously, 95% is a basic benchmark for an average general practice, and that number may change a little bit based on specialty, type, fee-for-service versus PPO practices, Medicaid if that's involved, can all start to throw those numbers off just a little bit. So use 95% as a benchmark, not a hard and fast rule, and use your head as you start to analyze that number. Second, look at the total amount of hygiene production to total production. The magic number here, 25%. A healthy office will see about a quarter of the total production in the office coming from hygienists. Why is this so important? The more butts that sit in seats, the more dentistry the dentist is likely to do. The only time a dentist is going to have the opportunity to do a procedure in someone's mouth is if a hygienist has seen them first or if there's pain involved. That's not strictly true, as I know you guys know, but that's generally true in most cases in most dental practices. A healthy practice where you have the opportunity to do the dentistry that you want to do, work with the patients you want to work with, is going to be one where you have enough opportunities to diagnose and see the types of patients that you want to see. The more hygiene that's being done gives you more opportunities to work with the patients and work with the types of procedures that you want to work with. 25% is a good rule of thumb for general practices, obviously. If you're a specialist, this isn't necessarily going to apply to you. If you're a specialist and you're looking at a practice with some hygiene or something related to this and you've got a question, this is a perfect opportunity to give me a call. I answer questions like this all the time. Videos like this are too short to go specialty by specialty. If I were looking at a practice with hygiene production in the 20 to 25% range, I wouldn't necessarily panic there. That can be a practice where hygiene numbers are still healthy, they just need a little help. Anything under 20% and I start to take note. Those tend to be practices where patients are doctor-driven. They tend to be really focused on or in love with the seller specifically. The personality, the style, the types of procedures they do. It's not that you can't buy that practice and be successful, it just increases the risk a little bit of you taking over for someone who has that type of loyalty with their patients. We actually like to see patient loyalty to the staff. We love it when the patients love the front desk. They love their hygienist. That keeps the patients loyal. It keeps them coming back to the practice no matter who is actually doing the dentistry. Of course, there are all kinds of caveats to this, and if you're looking at a situation where you've got questions, give me a call. Number 3 on the list is the actual production by procedure codes. These are the actual ADA codes, right? How many 0210s are we looking at? How many 2740 crowns does this practice actually do? What I like to do when I'm analyzing a practice is I'll get the production by procedure report. This is the report that has the actual ADA codes on the left-hand side of the report. Open Dental, Dentrix, EagleSoft, they all have the ability to produce this report. I like to see the actual ADA code, and I like to see a count, how many procedures did that office do in a calendar year, and I like to see what are the dollar figures associated with either the production or the collections of that ADA code. Then what I do is I rank them. What are the top 10 money-making procedures done in this office? Can you, as the buyer, do them? Is the buyer that I'm working with interested in doing number 7 on the list? That might be implants, might be Invisalign, could be something that is relatively lucrative that the buyer just doesn't have much interest in doing. If I can look at the top 10, usually that's 60 to 70% of the total income for that practice. Obviously, you'd want to look at the rest of the list, see what number 15 is. See if that office isn't maybe doing a procedure that you can do. If you're really good at extractions and the seller doesn't do hardly any, well, great. You might have an opportunity to boost your production by keeping some of the referrals that this seller is sending out to other people. But if you start with the top 10, you're going to get a good sense of whether or not this practice does a lot of specialty stuff or if they're mostly bread and butter in terms of their production mix. Looking at the production by procedure report can tell you a lot about the philosophy of the seller. It tells you whether or not what the seller told you they do clinically and philosophically lines up with what actually takes place. Are they actually doing the things that they think that they're doing? So in other videos, I've talked about the importance of making sure your philosophy lines up reasonably well with the seller. This is going to be where you can check that. Obviously, talking with the seller is a big, important data point. And looking at the actual numbers to verify whether or not the philosophies line up, that's what's going to get you what you want as a buyer. So to recap, when you're looking at production, you've got some numbers in front of you. Yes, I love numbers, but don't get too enamored with production numbers. Always think of the finances first, production second. And when you do look at production, look at 3 things. The ratio of production to collections, how much hygiene is actually being done in the office, and number 3, look at the actual ADA procedure codes and see if they line up with your expectations of a practice that you'd like to buy. This can get complicated. The formatting of these reports sometimes gets a little funky. It's always a crapshoot of the information you're going to get as a buyer. If you run into a situation where you're not sure the production you're looking at lines up, or you just have a question about how to read something on a report, that's when you want to give me a call. We've got videos like this, of course. We've got courses, podcasts, but you're also able to get on my schedule almost anytime. Come out to the website, dentalbuyeradvocates.com. Go to the Contact Us section. You can schedule some time with me for free at a time convenient for you. I'd love to be of help, and good luck.